everybody. We are back with our Cabral House Calls. First Cabral House Call of the weekend. Every single weekend, Saturdays and Sundays, if you're new to the show, we answer our community's questions. You can write in, submit your own question at stephencabral.com/askcabral, and I'm always happy to listen in to what the community has going on and answer those questions as well. So without further ado, let's dive right into your questions. First one today is from Amy. Amy wrote in on 10/26. So just letting you know, this show goes live 11/29, which means we're only about 4 to 5 weeks behind. So if you've written in more than, let's say, 6 weeks ago, please feel free to write in again. But most likely, your question's been answered. We get to every single question. We never cancel any of them out. We don't even edit them. But if yours was a customer service question, just write in so you get, because again, we don't look at these for weeks. So feel free to write in at support@equi.life for any labs or nutritional supplement protocols, etc. All right, and as I always say, I don't do any prep work ahead of time. I read these questions for the first time. My amazing team puts them all together, and I love that because it's like we bumped into each other at our annual live event or a coffee shop or the airport where I see people all the time. Or last week I was at an event in Florida and a bunch of people came up, said hello, and again, I always appreciate that and thank our community. All right, so first question is from Amy. Amy says, "Hi, Dr. Cabral. I really appreciate everything you do for the community. My question is about heart palpitations for someone in perimenopause. I notice them only slightly during the day, but it seems really to ramp up in the evening. In addition, my energy plummets and I feel incredibly tired and foggy headed. I've had my hormone levels checked and everything seems fine. So I'm wondering if you have any thoughts on what should I check next. My gut tells me maybe I should look into cortisol, but I also know it could be one or multiple other factors. Appreciate your thoughts." Happy to help, Amy. So yeah, you're completely right. And again, thank you for writing in. So the problem is women and men get their hormone levels checked on their blood work. And women aren't even necessarily given a specific time during their cycle. I think it said you're in perimenopause to get yours checked, where we want them checked during days 19, 20, or 21, about a week before you would get your menstrual cycle. And it's okay if it's a little dysregulated, but you'll look at the times of maybe the most discomfort during your cycle. And at the same time, though, you want to look at your cortisol times 4 for the day. You want to look at your thyroid. So not just TSH like they run on blood work, but your free T3 and free T4 and your TPO antibodies. You want to look at your vitamin D and you want to look at your hemoglobin A1C. And if possible, we run insulin as well. So we run the stress mood and metabolism test. That's how you figure out what's going on. Because ultimately, like no doubt in my mind, and I would also run the minerals and metals test if I were you. Those are the 2 labs I'd run. Minerals and metals test to look for electrolyte stress imbalances. Like for sure, yours could be a calcium magnesium imbalance or a sodium magnesium, not just sodium potassium, but sodium magnesium imbalance. Without a doubt, that could be a big part of what we're looking at because especially as women move into perimenopause, there can be a greater need for magnesium, but not just magnesium, calcium balanced with magnesium, and then looking at electrolyte levels and not overdoing sodium as well. That's incredibly important. Now, like you just mentioned and what your gut is telling you, this could really be a cortisol-based issue. Lower cortisol the first half of the day, which we see all the time in perimenopause, in menopause, and then higher levels at night. So that is going to lead to then more of that heart palpitations. The more norepinephrine you produce, the more the heart's going to start to pump like adrenaline, right? And then also subsequent cortisol production. If you're feeling any anxiety at night, kind of the wiredness at night, or kind of difficulty calming down the engine from revving, most likely it's an upside down or inverted cortisol based issue. Run the stress mood and metabolism test. That's number 1 for you. Number 2 would be the minerals and metals test. I would of course love you to run both. Those are at stephencabral.com/shop, and you can just search them over at EcoLife. Okay. And of course, those come with a full consultation and a full plan with my amazing team. Whitney's up next. Curious about your perspective on various Medspa type aesthetic treatments like collagen tightening, usually via radiofrequency, heating deeper layers of tissues, laser for dark skin spots or resurfacing, PRP microneedling or home microneedling. Wondering if these will have other damaging side effects. Thanks. Okay, yeah, happy to answer this. So I am not the biggest fan, and again, I know estheticians might get mad. I'm not the biggest fan of some of the deeper radio frequency and heating or deep. I'm just not a fan of those. Here's why. Yes, there can be some short-term tightening, but it can start to damage the collagen matrix at a deeper level. It's the same reason for your face. I'm an advocate of microneedling, but I always say be careful with going too deep. Because yes, too deep is going to potentially give you maybe shorter term benefits, but long term damaging the adipose tissue, which is very sensitive below the cheeks, which already starts to fade as we get older, right? That's why some people get filler, or maybe they get fat grafting in their cheeks. The temples start to hollow out, the cheeks start to hollow out. My cheeks are definitely, I never had cheeks to begin with, like that's not part of my genetics. But, as I've gotten older, it's even less so, right? You can have bone resorption, especially for people like me with a deviated septum who would breathe through their mouth for the first 25 to 30 years of their life. So all these things can happen. All right. So do I have an issue with lasers? No, I don't have an issue with laser resurfacing. But you have to just be careful that there's not any hyper or hypopigmentation. So you want to go to a really good esthetician, a really good med spa individual. Might be a nurse practitioner, might be a doctor, but someone who really knows what they're doing so that they can help with some of the fine lines, wrinkles, age spots, etc. I don't have an issue with that, but again, there could be hypo or hypopigmentation, which is not too dark or too light matching your natural skin tone. Be careful with the deeper frequencies for right now in the heating. Be careful with anything heating deeper under the skin. The PRP, which is basically plasma, so you're call it like a vampire facial, right? So you're taking out your blood, you're spinning it, you're separating out the plasma rich and platelets, and then you're microneedling and then placing that back on the face. I don't have an issue with that. There seems to be some really good evidence behind that and helping with cell production with the microneedling and then the repair with that. Now, all of these are going to be kind of like short-term inflammation and damage. So use your zinc, use something like Healthy Gut Support, which has the zinc and the glutamine, which is great for the skin in general. Use your vitamin D3, use your omega-3, and then get just like a good methylated activated multivitamin or daily nutritional support. That's kind of like your minimum. All right. Oh, and then the advanced collagen support. I use that every day. That just goes in my shake. So hopefully that's helpful. All right, Whitney. Whitney's got a second question. Whitney says, what are your thoughts on tattoo removal? I was thinking about getting some tattoos removed, but wasn't sure if I could detox my way out of all the harmful side effects, since I guess my body would have to do something with that ink that was removed, or is it just as harmful as it is now in my skin? Thanks. This is a great question. Really great question. Think about it like this. If your mercury amalgams in your mouth are like 15 to 20 years old, they might start to be upturned and not in great condition. If that's the case, we need to get them removed, right? But you probably want to do quadrant by quadrant. That's what a lot of good biological dentists that I chat with, colleagues of mine, I'm like, all right, let's say someone has 8 mercury amalgams. What are we doing here? And usually they're doing quadrant by quadrant. But remember, some of them are so deep, the tooth might no longer make it, right? And so now you might have to have a root canal, an implant. So there's a lot that goes along with it. Tattoo removal can be the same, right? Like, what are we looking at? How much ink is there? It's my recommendation that you find a good professional. And for tattoo removal, I would do it. You're going to most likely do it over multiple sessions. And during that time, I would do the heavy metal detox, which is going to include the universal binder, the fluorofilm, and then that antimicrobial for basically the Craxel chlorella and et cetera to help bind those up, and then use an infrared sauna. I would be doing infrared sauna for 30 minutes every single day as you're doing the tattoo removal process, just like if you were to have your mercury amalgams removed. So I would say yes, if it was me. I don't want a lifetime of leaking ink. What I want to do is make sure that I get that out of my body. That's how I would do it. Make sure you're healthy first, and then you can look into the process. But again, I can't give you medical advice, medical treatment plans, medical cures, or medical diagnosis. All right, Jody's up next. Hello, I'm scheduled to have an MRI with gadolinium, I always mispronounce that, based contrast this Friday. The reason for this is twofold. They want to look at my pancreas. My recent blood work shows I have very high levels of lipase and high amylase. I don't have any symptoms indicating pancreas issues. My lipase was also high in my blood work 6 months previous and has continued to climb. Follow-up scan for polycystic liver disease, well over 100 cysts on my liver, as well as solid lesions on my liver, which was believed to be benign when it was discovered about 7 years ago. Now I am beginning to panic as I've read that the metal from the dye cannot be fully detoxed. Is there another option for dye? More to say, but not enough characters in the EC meal. Yes, we have to cut people off just so that it's not only one question per show. All right, but I'm happy to help with this, without a doubt. There's actually a safer agent. If you have to use a dye, you can at least ask your radiologist and your doctor if you can use something called macrocyclic gadolinium agent, which is a little bit easier to detox on the kidneys. So it's just a safer form and it's more stable than the more linear forms that you're talking about. So that's at least one thing to ask. And then if they can do a non-contrast, then great. But I'm assuming they want to do the contrast because they want to see if any of these benign tumors, which they believe them to be, light up with the contrast, which might show then greater risk for cancer. So I totally get it. And I agree. I agree with that. You want to take a deeper look. There's no doubt about it. But, keep in mind that the elevated levels of lipase and amylase might be from like biliary obstruction. It might be from SIBO. It might be from consuming alcohol. So there's a lot of reasons for this, meaning like I could rattle off 15 to 20 reasons for high amylase and high lipase. So like there's so many reasons related to your gut, diet, digestion that we don't know. And then obviously this occurred 7 years ago. So we need to start understanding that the goal now is to, break down as many of these as we can through the 7-day quarterly detox or the 21-day once a year, plus then the quarterly 7-day, using things like proteolytic enzymes upon waking on an empty stomach. We want to work the process, and maybe some can shrink and get removed. And then of course the others, we want to make sure that nothing ever turns into, anything that could be more severe. All right. So Jody, hopefully that was helpful. And again, not medical advice, but of course I just share with you the exact answers I would give my own family. All right. Rebecca's up next. Rebecca says, "Hi, Dr. Paul. I had an allergic reaction to an antibiotic that caused me to lose consciousness probably at least 30 times or more. And in between losing consciousness, I would yell in pain because my whole body went into spasms. My brain was starving for oxygen, so it started taking the oxygen from the muscles because my body started shutting down. I have had brain fog really bad since over the last 2 months. Is there anything that I can do about this?" All right. Happy to help with this as well. And I'm very sorry that this, happened to you. This is obviously not something that anybody wants, but there's 2 things that we can do. So one is we're going to work right away on the brain and the nervous system. But the second thing we're going to do is test, just to kind of put like your mind at ease. So we would test something called the mind and mood neurotransmitter test. And we would also run the stress, mood, and metabolism test. Stress, mood, and metabolism test is going to look at cortisol levels. So we want that. But then the neurotransmitter test is going to look at your dopamine levels, norepinephrine levels. It's going to look at GABA. It's going to look at serotonin and a lot of other that aren't as well known neurotransmitters as well. So all of this, so that's called the mind and mood neurotransmitter test. And the other one's called the stress, mood, and metabolism test. You can find these at stephencabral.com/shop, and that'll take you right over to Ecolife. Okay. So the other thing though, in the meantime, we can use a few products. One of them is called magnesium threonate. We'll use that at before bed, 2 capsules, and full spectrum magnesium at dinner, 1 to 2 capsules. All right. So magnesium threonate before bed, magnesium full spectrum magnesium at dinner. Adrenal Soothe will also be a great one at dinner to calm any high or cortisol levels that sometimes people with TBIs or maybe losing consciousness might be dealing with. Again, not medical advice or medical treatment plans. The other one is omega-3s, 2 to 3 grams. I probably, if I were you, would use 3 grams for about 8 weeks, and then you could drop down to 2 grams. And then the daily nutritional support for all of your methylated B vitamins. 2 other products that are coming to mind is the vitamin D3 or D3 with K2, 4 to 5,000 IUs a day. And then also the last one is the daily brain support. I would use all of these for 8 to 12 weeks for sure. And then along with just some, maybe in my opinion, good detoxification, nothing strenuous, some light exercise, some walking, good sleep, 8 to 8.5 to 9 hours a night on a good sleep schedule will start to rewire that brain and decrease maybe some systemic inflammation. All right, hopefully this was helpful, Rebecca, and everybody wrote into the show. I appreciate you being a part of this community, and I'll be back answering more of our Cabral House Calls tomorrow on a second part. Take care, everybody.